In this video, we are going to talk about the foramina of the skull. Now, the first thing to realize is that there are 85 different foramina of the skull, and we're not going to learn all 85. In fact, we're going to limit it to 15 foramina, which we will continue to utilize throughout the entire course. And that's because most of these foramina are going to be involved with like the two largest blood vessels going in and out of the skull, or the 12 cranial nerves or the spinal cord. So let's go ahead and get started. And where we're going to get started is in the anterior view. And if you look at the anterior view of an eye socket, what you can notice is there are two slashes. There's this upward slash over here, and then there's a downward slash over there. And then just medial to them, there is an opening. And this opening is called the optic canal. And so I'm putting an orange pipe cleaner through the optic canal from the floor of the skull, and it's coming out through there. So you need to be able to identify most of our foramina on both aspects. So this one's very easy to find looking up the eye socket. And then on the floor of the skull, what you do is you find the sella turcica of the sphenoid bone, and you go slightly anterior to where you're going to be just on the edge of the anterior cranial fossa, and then just laterally on each side is where you are going to find the optic canal, as indicated in the picture on the left. The other thing I want to point out, this is called the optic canal and not optical. Okay, you go to an optical shop to buy glasses, but this is the optic canal. The next foramen we're going to find is still within the eye socket, but for this one, we are talking about that huge slash, okay, as seen in the picture on the left, the upward slash, which is known as the superior orbital fissure. And what this is actually the space between the lesser wing and the greater wing of the sphenoid bone. So it's not in the anterior cranial fossa or the middle cranial fossa, but this slash is between the two of them. And similar to the superior orbital fissure, we're going to have the inferior orbital fissure, which I think is probably seen better in the picture on the right. And so the inferior orbital fissure, superior orbital fissure, and optic canal, three different structures all seen within the eye socket. So the punched out hole, that's the foramen, and then the slashes, those are the fissures. Staying in the anterior view of the skull, we are going to find three foramina which are all aligned with each other, as demonstrated by this yellow line. They're not exactly on the line, but they're all very close to each other. So for the first one, we are going to look above the eye socket. Okay. And this one can appear one of two different ways. If it's a complete circle, it's called the supraorbital foramen. But in a lot of people, it's not a complete foramen, but it's just a notch. And I think if I go back to this picture, if you look at the right eye where I'm pointing, you can clearly see that this would be a supraorbital notch. Whereas on the left eye, you can see it's completely enclosed by bone, so that would be a supraorbital foramen. So you need to use the correct terminology. If it's a foramen, call it a foramen, and if it's a notch, call it a notch. And also remember, this is supraorbital, not superior orbital. Okay, superior orbital fissure is in the optic cavity. Supraorbital foramen is above it. So just like we had a supraorbital foramen in the frontal bone, our next foramen is going to continue in the same line, but now we're going to the bone that's forming a lot of the floor of the orbit, and that's going to be your maxilla. So we have an infraorbital foramen in the maxillary bone. And notice that this is maxilla and not zygomatic bone. You can clearly see the suture line between the two of them. So infraorbital foramen of the maxilla. And then continuing inferiorly, the only other bone we have left is the mandible. And for this one, it's going to be called the mental foramen. And for this, I want you to think of that big sculpture by that French artist called The Thinker, where the man has his chin on his hand, but usually we would sit and, like, oftentimes you'll see people thinking like this. Well, that's showing you exactly where these two mental foramen, mental thinking. Okay. So that's the mental foramen of the mandible. Okay. Clearly seen on the body of the mandible. Now, the mandible has a second foramen, and this foramen is on the inside, and it's on the ramus of the mandible. So I'll just put the pipe cleaner in it so you can see it. All right. And so this is where it is. And this one is called the mandibular foramen. So what happens here is there's going to be a nerve called the mandibular nerve, which when it exits from the cranium is going to come down, go through the mandibular foramen, and then it travels within the mandible, and then it will exit out through the mental foramen to give you some sensation out here. So we'll be talking more about that when we learn about cranial nerves later on. So that's it for everything that's anterior. Now we need to look at the floor. And the floor has a lot of foramina, most of which we'll learn, but I want you to realize that for a lot of these, you also can see them on the undersurface. So practice to make sure you can identify it on both sides. At the end of this, I think I have a labeled picture to help you, and also look in your pictures where there are models, because there's lots of unlabeled ones for you to practice labeling with. So the big hole in the middle of the occipital bone, that's called the foramen magnum, which just means the big hole. After this, what we want to do is orient it like this, so superior is anterior, and we want to travel in a 10 and 2 o'clock position, so going like that, okay? And so where we're going to go is there and there. We're not really going to travel into that posterior cranial fossa. We're going to stay right around the foramen magnum. And in fact, where we're going to be going is looking at the occipital condyle. And this one is called the hypoglossal canal. So looking in the foramen magnum, you can see the opening right there at the end of the arrow, because this little piece hanging down, that is the occipital canal. The occipital condyle. And the reason why this is called the hypoglossal canal as opposed to a foramen is when you have a punched out hole, whereas a canal is when you have like a tunnel going through solid bone for a distance. And so that occipital bone is, that occipital condyle, as you can see in the upper right picture, that's solid bone. And so it's going to travel for a distance, almost, almost a centimeter through solid bone. And that's why this is called the hypoglossal canal. Now go back to the foramen magnum, go back at the 10 and 2 position. We are going to get to our next foramen, staying in the posterior cranial fossa. But for this next one, there's actually something that leads right to it that can help you. So I'm going to go back to this picture, the hypoglossal canal, and look here on the left side of the large picture. And do you see this groove right in here? that leads you directly to that opening. Okay. And there's also one on the right side. You can see the groove leading you to the opening. That's called the groove of the sigmoid sinus. And this is a sinus that's not the air-filled bone, but this is the word sinus that refers to blood. In other words, this is a structure similar to a vein, but it doesn't have the 3 layers of a vein. So it's going to carry venous blood. And this is all the venous blood from the brain now that's getting ready to exit the skull. And it travels here in this sigmoid sinus, which leads it right to the next opening, which is called the jugular foramen. Okay, so it's kind of J-shaped, or jelly bean, not really J-shaped, jelly bean shaped. Okay, and this one is very easy to find, both on the inside. You can follow that groove or continue at 10 and 2, and you have quite that large hole. But you can find the same thing on the inferior surface of the skull, where it's quite large, okay, as shown in that picture, the jugular foramen. And then we have one more foramen while we are still in the posterior cranial fossa. So go back to 10 and 2. We did the foramen magnum, then we did the hypoglossal canal, then we continued up and found the jugular foramen, and we're going to start climbing up that mountain even more, but we're not going to go into the middle cranial fossa. And so the last one, we're going to continue up right to here. And this one is called the internal acoustic meatus. All right. So yes, the internal acoustic meatus eventually connects to the external acoustic meatus, which we can't put a pipe cleaner through. It's very convoluted, plus there are things like the tympanic membrane, which actually block passageway while you're alive. So don't be thinking you can poke something from the external to the internal acoustic meatus. Okay, that's it for the posterior cranial fossa. So now let's move into the middle cranial fossa, where we see lots of openings. Okay, so the first thing I want to let you know, this big slashy thing, not learning the name of it. Yeah, it's very obvious. Yes, I could teach you. It's called the foramen lucerum, but it serves no significant purpose clinically whatsoever unless you are doing brain surgery, and then we use it for a landmark. So just ignore that one. And what I want you to look for now is something anterior to it that is oval shaped. So we are in the sphenoid bone, and can you see this oval shaped opening? Okay, so that's called the foramen ovale. And the thing about the foramen ovale is not only can you find it by looking at the floor, but it's also very easy to see looking at the undersurface. It's going to be right there. I can see it right there just by looking at the little tiny picture in the corner. So that's the foramen ovale, and it's pronounced ovale, not oval. Just to remind you, put that E on the end of the word oval and you are there. All right. For the next foramen, once you have found your foramen ovale, I want you to go anterior and medial to it. And that little tiny circle, anterior and medial to it, is called the foramen rotundum. Okay. Yes, I know there's another one over here for spinosum, which we're not learning. Okay. So foramen rotundum, which is also on the sphenoid bone. Okay. That's it for the sphenoid bone. Now we have the carotid canal, which is very difficult to see looking at the floor of the skull because it's actually angling backward into that mountain. So you have to turn it, and you have to turn it at an angle, and then you can see exactly where it is. But lucky for you, you don't have to do it. That's why I have the little dotted arrows to let you know that's where it is. However, on the undersurface of the brain, it's very easy to find. The first thing you do is you find the jugular foramen which is that big jelly bean structure right here. And then because this carotid canal is going through this mountain of bone in a posterior direction, angling towards the jugular foramen, on the inferior surface, that opening to the carotid canal is directly anterior to the jugular foramen. So in the picture on the right, the blue nerves, that's indicating the carotid canal. So you can see it's opening there. But then that jelly bean line underneath, that's the opening for the jugular foramen. And by the way, on this view, if you continue anteriorly, you also have the opening for the foramen ovale located there. So that is it for the middle cranial fossa. And for the anterior cranial fossa, there's only one foramen, the olfactory foramen, also known as the cribriform foramen. But because each cribriform plate has many of these, I pointed to a lot of them and I wrote the plural term because I didn't want you to think that only one of these was the correct foramen. Okay. So here in the middle, that's our crista galli. And then this is a big cribriform plate with all these little holes on both sides. So to refresh your memory, we're way up here. Yes, we're way up here now. And so the cribriform foramina are on both sides of the crista galli. And there's lots of little tiny holes there. Okay. So here are pictures of the floor of the skull and the undersurface of the skull. So feel free to stop it here or do a screen cap and practice labeling. I also gave you other pictures where you can practice. And then this last picture is showing you half of a skull with some bony landmarks in there to make sure you know where you are. And then I have tagged all of these, and for most of them, I have written what goes through them. But do not just rely on this. Go to your table, which lists your cranial nerves and the foramina, and that will tell you what you need to know. Like for instance, the superior orbital fissure has 4 nerves that go through it. The interacoustic meatus has 2. The jugular foramen has 3 nerves plus a blood vessel. The carotid canal has a blood vessel that goes through it as well. Okay. So yes, you need to learn not only how to identify these, but also what goes through them. And with that, we are done with this section. So I want to thank you for all your hard work, and I look forward to seeing you again soon. Thank you.